Hello, welcome to Riversoft University. My name is Shelley Wolf, and today we will be reviewing Start of Care Part 9, Post-Assessment, Medication Review, and Medication Administration. From our Start of Care note, we will click on Medication Review. This will take us to a current list of all the medications our patient is taking. You will also notice in the upper left-hand corner, your allergies will be displayed. You can sort your medication list by medication name, regimen, start date, and all the other headers. By reviewing your medication list, you have the opportunity to lock down the medication list based on what you reviewed. Your medication list will constantly be refreshed every time you revisit the medication review page. So, in order for you to review the medications and lock down the medications so they are no longer refreshed after you've reviewed them, you will be able to check on the medication review box. At this time, they will no longer be refreshed. You also are required to address one question on the medication review page. Address with the patient's physician any problems identified within one calendar day. Once this question is answered, the medication review screen has been satisfied. From this screen, you can also show a medication profile for your patient, and you can show a med administration record if medications have been administered. You also have the opportunity to use the look back feature for any medications that have been reviewed throughout the patient's episode. Medication administration is where you will administer or for some reason not be able to administer a medication. You will notice the patient's current medication list, whether or not it's been administered or not administered. By clicking on administered, it will give a time stamp and a date stamp. If this is an injection, you'll simply click on the injection, and it will give you all the areas you need to document on that injection. By selecting IV, it will give you all the areas needed to document on that IV. If you are experiencing side effects with this patient, if you check on side effects, you will be able to document on the side effects that you are encountering. By checking on the comment field, it will give you a comment area to add additional documentation to this medication administration. If a medication for some reason cannot be administered, by clicking on that, it will ask for a reason the medication was not administered. It could be that you're just pre-pouring the medication, the patient has already taken the medication, they refused the medication, they were not home, medication was not available, and emergency meds taken by patient. You still have the opportunity to add an additional comment as well. From the medication administration screen, you can visualize a medication profile, your medication administration record, and you have the opportunity to address the associated OASIS questions. Once these are satisfied, this tab will also turn blue stating that these OASIS questions have been satisfied. We've included an I button for you on this screen. I highly recommend you read the I button for a more detailed explanation on medication administration. So now you've reviewed your medications and you've administered any medications that were necessary. So this concludes our review of medications and medication administration. Thank you. Bye-bye.